If you're dealing with bloating, food reactions, or gut problems that won't go away, I'm going to show you the natural leaky gut recipe and routine that's helped so many of my patients heal their gut. I'm Dr. Nirvana, a naturopathic doctor with 20 years specializing in gut health and women's hormonal medicine. And this isn't a trendy wellness hack I read about online. This is a clinical recipe I've used with so many of my patients. Real people who had tried elimination diets, probiotics, every supplement on the shelf, and were still symptomatic. The secret isn't just the ingredients, it's understanding why the gut lining broke down in the first place, because if you don't address that, no recipe in the world will hold. So, today we're covering how leaky gut actually happens, important safety notes about it before you try anything new, and the full recipe, how to make it and what to expect. If this is the video you've been looking for, hit that like button and let's jump into it right now. Okay, let's start with what leaky gut actually means, because the term gets used a lot and the mechanism behind it matters more for understanding why the recipe works itself. Your gut lining is a single cell layer thick. That's all that separates the contents of your intestine from your bloodstream. And those cells are held together by something called tight barrier junctions, which are protein structures that act like the grout between tiles, keeping everything sealed. When those tight junctions break down, the seal fails. Undigested food particles, bacterial fragments, and toxins start slipping through the bloodstream, a process called intestinal hyperpermeability, or what most people call leaky gut. Your immune system, which lives just underneath the gut lining, sees these particles and goes on high alert. It starts producing an inflammatory response. And because it's working overtime, it sometimes starts producing antibodies that cross-react with your own tissues, which is one of the mechanisms behind autoimmune conditions like Hashimoto's, rheumatoid arthritis, and others. This is why leaky gut doesn't just cause digestive symptoms. It causes fatigue, brain fog, skin issues, joint pain, food insensitivities, and hormonal disruption. Because once your immune system is chronically activated, it affects everything downstream. So, what breaks down those tight barrier junctions in the first place? There are 5 main drivers I see consistently with my patients. Number 1 is chronic stress. Cortisol directly increases gut permeability. This is one of the most well-researched mechanisms and one of the most overlooked in gut healing conversations. You can't supplement your way out of a gut that is being continuously broken down by a nervous system in survival mode. I want to stay on this one for a moment because it's the driver that gets skipped the most. When your body is under chronic stress, whether that's from work pressure, poor sleep, a difficult relationship, or just constant low-grade hum of being overscheduled, your nervous system is running in sympathetic mode, fight or flight. And in that state, blood flow gets redirected away from your gut. Digestive enzymes drop, gut motility slows, the mucosal lining thins. Your body is not focused on digesting lunch when it thinks it's running from something. So, what I see clinically in patients who are doing every single gut protocol right, the right diet, the right supplements, the right sleep hygiene, and still they're not healing, it's because the cortisol piece hasn't been addressed. The gut can't repair what the stress response is continuously tearing down. Number 2 is diet, specifically gluten, processed foods, sugar, and alcohol. Gluten triggers the release of a protein called zonulin, which directly opens up those tight barrier junctions. This is not a sensitivity issue. This is a physiological mechanism that happens in everyone in varying degrees. And the third is dysbiosis, which is basically just an imbalance in the gut microbiome. When the bacterial ecosystem in your gut is disrupted, pathogenic bacteria produce compounds called lipopolysaccharides that actively degrade the gut lining. Antibiotics, poor diet, and chronic infections are the most common causes. Number 4 are medications, particularly NSAIDs and ibuprofen, like naproxen, which are well documented to increase gut permeability even with short-term use, and proton pump inhibitors, which alter the gut environment in ways that promote dysbiosis. And the fifth one is chronic infections, parasites, H. pylori, candida overgrowth, and SIBO. These create a sustained inflammatory environment that keeps the gut lining from repairing itself even when someone is doing everything else right. The reason I'm telling you all of this before we get to the recipe is that slippery elm is incredibly effective at soothing and rebuilding the gut lining. But if you're still exposing yourself to the things that are breaking it down, you're bailing water out of a boat with a hole in it. The recipe supports healing. Removing the drivers is what allows healing to actually stick. Now, before I give you the recipe, I want to cover some safety considerations first because people with gut issues often have more going on than they realize. Slippery elm is generally very safe and it's been used in herbal medicine for centuries, but there are a few things to know before you start. First, slippery elm can slow the absorption of medications and other supplements because of its mucilaginous coating effect. If you're on any prescription medications, take slippery elm at least 2 hours away from them. This is not optional. It's a real interaction mechanism. Second, if you have a known allergy to elm trees or the ulmus family of plants, obviously skip this one. And third, if you have IBD, Crohn's disease, or ulcerative colitis, please talk to your gastroenterologist before adding new herbal protocols. These conditions can look like leaky gut on the surface, but require a more careful and individualized approach. The fourth, if you're pregnant or nursing, talk to your midwife or OB before starting. Slippery elm has historically been used to support pregnancy, but dosage and timing matter, and this should be supervised. And fifth, start low and give your gut time to respond. If something feels off, increased bloating, changes in digestion, any new symptoms, stop and pay attention to what your body is telling you. More is not always better, especially with a gut lining that's already compromised. Low and slow, always. Quick side note, if you've been dealing with gut symptoms for more than a year and nobody has connected the dots for you, then drop a comment below and tell me what your biggest symptom is. I read all of your comments and it'll help me to know what type of videos you're looking to learn next. You might be surprised how many people are in the exact same situation. So here is the slippery elm recipe. And I'm going to tell you why each ingredient is in here, because understanding the mechanism is what makes you actually stick with it. The base is slippery elm powder. Slippery elm comes from the inner bark of the Ulmus rubra tree, and when it gets wet, it forms a thick gel-like substance called mucilage. That mucilage coats the gut lining directly, like a soothing bandage over an irritated surface. It doesn't just reduce inflammation. It physically protects the lining while the cells underneath it repair. It also acts as a prebiotic, feeding beneficial bacteria, and it has a mild anti-inflammatory property that helps to calm the immune response in the gut wall. To that base, I add L-glutamine powder. So glutamine is the primary fuel source for the cell's lining, the small intestine particularly, the enterocytes. Without adequate glutamine, those cells can't regenerate fast enough to repair the lining. A lot of research has consistently shown that glutamine supplementation supports intestinal barrier function. The next is aloe vera, inner leaf, not whole leaf. The inner leaf gel contains compounds called acemannins that have direct anti-inflammatory and tissue-soothing properties in the gut. It also supports mucous membrane integrity throughout the entire digestive tract. Here's an important note though. Whole leaf aloe contains substances that can be a strong laxative, so inner leaf only for this recipe. Then, unflavored grass-fed collagen. Collagen provides the amino acids glycine and proline, which are the raw structural materials for repairing the connective tissue on the gut lining. Glycine in particular has anti-inflammatory properties and supports the tight junctions we talked about earlier. And finally, a pinch of ginger powder or fresh ginger. Ginger is an anti-inflammatory. It supports motility, meaning it helps move things along in the gut at the right pace, and it's been shown to reduce intestinal inflammation. It also makes the whole thing a little bit more tasty, significantly less like a health obligation. Here's how to put it together. In your glass, combine 1 teaspoon of slippery elm powder, 1 teaspoon of glutamine powder, 2 tablespoons of inner leaf aloe vera juice, 1 scoop of unflavored collagen peptides, usually about 10 grams depending on your brand, and a small pinch of ginger powder or even a thin slice of ginger. You can even grate it and put it in. Add about 8 to 10 ounces of warm water, not boiling, just warm, and then stir it well. The slippery elm will start to gel slightly, which is exactly what you want. And drink it slowly. Timing matters here. Take this on an empty stomach, first thing in the morning, at least 20 to 30 minutes before food. This gives the mucilage time to coat the gut lining before anything else comes in contact with it. If you want to do a second dose, early evening, before dinner works well as well. Remember the medication rule. If you take medication in the mornings, either take them first and wait 2 hours before the recipe, or take the recipe first and wait 2 hours afterwards. Do not mix them. Start with once daily for the first week. See how your gut responds. If you feel good, you can move to twice daily from week 2 onward. Also, this recipe is a powerful supportive tool. But if you've been dealing with leaky gut symptoms for a long time, or if you've tried gut healing protocols before and they haven't helped, there is usually a root cause that hasn't been identified yet. This is exactly the work that I do inside the root cause program, where we run the right labs, identify what's actually driving the permeability, whether that's an infection, a microbiome imbalance, a cortisol issue, or something else entirely, and then we build a protocol around your specific picture, not a generic supplement stack. The link to learn more and book a consultation is in the description below. If you've been managing symptoms and are ready to actually find the cause, that's where to start. Now, let's talk about timeline, because this is where most people either give up too early or get confused about what's happening. In the first 3 to 5 days, some people notice a reduction in bloating and a calmer gut. Others notice nothing yet, or occasionally slight increase in symptoms as your gut starts responding to something new. Both are normal. If symptoms significantly increase, refer back to the safety notes and consider dropping to a smaller dose. By week 2 to 4, you might start to notice more consistent changes, less reactivity to foods, reduced bloating, more regular digestion, and sometimes improvements in energy and in your skin that seem unrelated but are often connected to the reduced immune burden. Real gut lining repair takes time. The enterocytes, the cells lining your small intestine, have a turnover rate of about 3 to 5 days, but the structural repair of the tight junctions and the rebalancing of the microbiome takes weeks to months depending on how long the gut has been compromised and whether the underlying drivers are being addressed at the same time. I had a patient named Jennifer who had been dealing with all sorts of food reactions for 3 years. She'd been tested for allergies, tried elimination diets, saw 3 different specialists. No one had ever run a comprehensive stooling. No one had ever looked at her cortisol pattern. No one had connected the fact that her symptoms had started during one of the most stressful years of her life. When we ran the right labs, we found H. pylori, a significant microbiome imbalance, and a cortisol curve that was completely flat by that afternoon. That combination, an active infection, a disrupted microbiome, and a stress response that had been running on empty for years, was exactly why every gut protocol she had tried before had failed to hold. When we identified those root causes and added this protocol alongside targeted gut repair support, she started noticing fewer reactions within 3 weeks and was eating foods she hadn't tolerated in years by month 3. And she told me at our follow-up appointment that for the first time in 3 years, she had gone an entire week without planning her day around her gut. That is just the best thing. This is what finding the root cause actually looks like. Gut healing is not linear. Some days feel better, some days feel the same. The trend over weeks is what matters, not the day-to-day fluctuations. And if months in you're still not seeing the improvement you expected, or if your symptoms are complex enough that a recipe and a routine aren't cutting it, I want to encourage you not to just try the next thing on the internet. The reason protocols don't hold is almost always that the underlying driver hasn't been found. That's the work that I do in the root cause program. And the link is in the description if you want to learn more. I'd love to help you actually get to the bottom of this. So, here's where we landed today. Leaky gut is real, it's measurable, and it's driven by specific identifiable causes. The slippery elm recipe works by coating and protecting the gut lining, fueling cell repair with glutamine, soothing inflammation with aloe and ginger, and providing the structural raw materials with collagen. But the recipe does its best work when the drivers, stress, diet, dysbiosis, medication, infections, are being addressed at the same time. Start low, go slow, give it real time, and if you're not getting there on your own, I'm here to help. Your gut is not supposed to be this hard.